You're listening to Vet Synapse, a podcast connecting the world of research, innovation, and practical help to the veterinary profession. I'm your host, Dr. Philip Judge from Vet Education. Let's get connected with Vet Synapse. Hello everybody, welcome to another episode of Vet Synapse, where we bring the world of research into everyday clinical veterinary medicine. My name's Philip from Vet Education, your host for the podcast, and I'm very, very happy to welcome today a very special person, Shelley Gunther, and she is an ultrasonographer who's working with Clarius Ultrasound. Shelley, welcome to the podcast today, and I'm wondering if you could just share with our listeners a little bit about what you have been up to as a sonographer, and then we're going to talk about portable ultrasound.
Great. Yeah, thanks so much for the invite, Philip. Really nice to be here. Just a little background. I am a diagnostic medical sonographer. I've been in the field for over 30 years, and I've worked in both hospital and clinic practices, in large and rural remote hospitals, and have experience in most applications of ultrasound. I've also worked in ultrasound sales and clinical applications training for a couple of different companies, and I joined Clarius Mobile Health about 4 years ago. Clarius is a point of care ultrasound company. I was hired to help lend my clinical knowledge to the marketing and product development teams, which has really been a blast. So when I joined Clarius, I had a little experience in veterinary ultrasound, but I've absolutely learned so much from the vets that we work with closely to develop our educational content.
Great. Thank you so much for that introduction. And I guess given your experience, you have had or been able to use machines that are enormous and worth several hundred thousands of dollars down to what now is pretty impressive portable ultrasound. And I'm just wondering if you could tell us a little bit about why portable.
Yeah, portable ultrasound is amazing. I mean, miniaturization is changing the world, right?
Mhm.
I think having it in a small animal practice, it just allows for flexibility. Imaging can be done right in the exam room, in the treatment area, even out in the field. You can take it cage side, wherever you want to be. The one thing I love about ultrasound is that it's a non-invasive imaging modality, and our pets are already stressed during a vet visit. And so being able to get really good, valuable information quickly without heavily sedating them, it's great. And we really can't do that with other imaging modalities. And, speaking of other imaging modalities like CT or MRI, they're super expensive and often not readily available. So ultrasound is affordable and much more accessible for your patients. So, and because it's quite compact, vets can use portable ultrasound during house calls, like in a variety of settings, mobile clinics, or at a shelter medicine programs, extending care outside the traditional hospital or clinic setting. So all of these things make it for better, more efficient care for our patients. So, having portable ultrasound really, I think is an important tool to have in your tool belt.
Yeah, it takes it to the next level. I'm an emergency veterinarian myself, and being able to take your diagnostic test to the patient and not the other way around is a huge thing, especially for
Yeah.
those hemodynamically and particularly respiratory unstable patients where you don't want to be handling them and manipulating them all the time. And portable ultrasound, I actually use one of the Clarius handheld units myself, and it's a game changer to be able to take your machine, stick the screen into a cat's cage, and actually just approach that cat, and the cat doesn't get stressed. It's not being handled or anything like that at all. I find it personally very, very fulfilling and very, very useful for the situation that I'm working in. I want to ask you about what makes a good portable ultrasound probe, because there are quite a few out there, and I just want to explore a little bit about what are the features that make a portable ultrasound probe a really good portable ultrasound probe.
Yeah. Like in my opinion and in my experience, being wireless is the ultimate in portability. So if you can find something with wireless capabilities that's able to do all of the things that you need it to do, I'd say that's pretty valuable. And as you said, Philip, it could be a game changer. And with portability, it comes a need for durability. So if you're transporting an ultrasound system from room to room or clinic to clinic, it should be able to withstand being jostled around a bit or even being knocked off the exam table during an ultrasound study. I'm a big proponent, being a sonographer of image quality. Image quality is extremely important. And I always say if you can't see it, you can't diagnose it. It's often assumed that you have to sacrifice image quality when you buy a smaller, more portable ultrasound system, but that's not always the case. And especially of late with miniaturization kind of taking over the way it is, an ultrasound system should be really easy to use. You don't want a complex system that requires lots of keystrokes, lots of button pushes to get a decent image that's going to be diagnostic. And it should be affordable without sacrificing image quality.
Yeah, and we live in this digital age where we're used to looking at screens and touching them and zooming in and zooming out with our fingers on a screen. And when I've been using my ultrasound probe, it's so nice just to be able to do that rather than to focus on a keyboard and to be making keystrokes and to have to learn that stuff. You pretty much poke the image and you drag the image sideways or up and down to alter the depth and the contrast and everything else in the machine as well. What about things like AI? Are they making an appearance within the ultrasound, within the software that helps make these things run a little better?
Yeah, there's a lot of different AI that's coming about, and the AI can be used for simple things like optimizing your image on the fly, to performing measurements for you, or helping you to learn ultrasound, or something that we have is called auto heart rate, which you plunk the scanner down on the pet's heart, and without an ECG, it'll give you a heart rate. So there's lots of, and we have lots of more features kind of coming down the pipe for educational purposes. But yes, absolutely, AI is really having an impact on what is being developed. People want to see more things to make it easier to use.
Great. Well, you've mentioned a lot of pretty cool things about what makes a portable ultrasound machine a good portable ultrasound machine. I want to focus now on the Clarius veterinary portable ultrasound probe. All of our audience are veterinarians, some are veterinary nurses and technicians as well. And so this is really where the focus is. A lot of our audience is small animal practitioners,
Mhm.
small animal veterinary nurses and technicians as well. What is it, what sort of features does the Clarius portable ultrasound probe have that kind of meet the criteria that you mentioned before about what makes a good ultrasound probe a good one?
Yeah. I think, first of all, as I mentioned earlier, the Clarius probe is wireless. It makes it truly portable, and you can take it anywhere. You don't have to worry about running over your power cord, having a place to plug in, running over your transducer cable. Instead of a cable, the scanner's got a built-in router that connects to the app wirelessly. So you don't need Wi-Fi to perform an exam. Being wireless also lets you take, sorry, being wireless also lets you scan your patient without dragging the transducer cable over them. And sometimes that can be startling as well. Our vet scanner is called the C7 microconvex, and it has a nice frequency range of 3 to 10 megahertz, which really covers pretty much all dogs and cats for size. It's got a nice small footprint and a very large field of view, 112-degree field of view. So you can get into small spaces or scan between the ribs for really nice imaging in a variety of applications, from cardiac to lung to abdominal, bladder scanning, things like that. And one thing that makes it super suitable for vet imaging is that it's tough. It's perfect for veterinary uses. It's been drop tested and it's fully submersible. So you'll be able to use this anywhere and not worrying about being able to submerge it if you want to do a good clean. The Clarius uses traditional ultrasound crystal technology. So this is similar to what you see on larger cart-based systems. This allows us to produce really high quality imaging and includes things like color and power Doppler, as well as pulse wave Doppler if you need to perform like hemodynamic assessments. The app, which is free to download when you purchase a scanner, it's very easy to use. We say like if you can use your phone, you can use the Clarius app. It's nice. It has dedicated vet settings or presets to optimize your imaging in a variety of anatomical areas. There's also built-in image optimization, as I mentioned. That's part of the AI features. It just reduced the steps needed to get a good image. And for example, there's different settings for cardiac imaging versus abdominal imaging. The Clarius app really does a lot of the legwork for you. And one of the AI tools that I didn't mention, one of our most popular ones, is something called voice controls. So this allows you to make adjustments to the image, things like freeze, capture image, increase or decrease your depth or gain without having to touch the screen. You just turn on the voice controls and start talking. So it's really nice when you're by yourself and you need one hand to scan and the other one to hold your patient, or if you're just a little out of reach of the screen, or if you're doing a procedure for that, for example. So lots of cool features on that little scanner.
Absolutely. I certainly would agree with you that certainly the lack of a cord is a huge thing, because certainly just running over your cord, even having animals bite the cord as well. And the traditional ultrasound machines with that cord between the machine and the transducer, if that gets damaged, they can cost an awful lot of money to try to replace there as well,
Yeah.
can't they?
Yes.
What are some of the resources? You mentioned a couple of resources that users get when they get a Clarius ultrasound probe. But I understand that you have a really good, well, I know you have a very good education program, because I've attended many of the lectures that you have and the webinars that you run. But there's also a whole bank of really useful short videos or video tutorials that walk people through how to obtain a good image, but also how to image various organs in the body as well. Do you want to just expand on that a little bit?
Yeah, we've lots of educational resources that are all free. We do a bunch of, we call them Clarius classroom videos, and those are just anywhere from about 2 to 5 minutes, and they're, as you mentioned, they're kind of how to scan or what to look for in a cardiac exam or in a patient with pulmonary hypertension or something along that lines. They're just kind of short how-to videos, and they're performed by our amazing KOLs. And yeah, so anywhere from ultrasound techniques. We also have some very interesting case studies in there as well, which are very, I've learned a lot from them. We also host several free veterinary webinars each year, and the viewers can watch them live or download them to watch at their convenience. So those are really nice, and they're typically an hour long. We're constantly improving the app for better and more efficient imaging. So app updates happen about quarterly with new features and enhancements, and these are all free to our customers as well. Yeah.
Great. I think that those features are really helpful. And I personally, and I should have full disclosure, I'm not being paid by Clarius. I just bought their ultrasound probe a couple of years ago, and I absolutely love it. Like
That's
it's
great.
brilliant in my line of work. So everything I'm telling you is not a paid endorsement at all. But I find that the ability to have that software updated, to have the AI that works to optimize your image and the quality and those sorts of things is so incredibly helpful. And many times if you buy, say, a bigger machine that is not wireless, it doesn't have those updates, you're stuck with that technology for the life of that ultrasound machine. Whereas this probe does give you that ability to have the software updated on the fly, so to speak, so that your probe
Mhm.
adopts the latest technology that's
Yeah.
available, the software technology over a period of time. So,
Yeah. There's no
yeah,
downtime, right? Like you don't need to have a service tech to come in and perform your updates. So you don't have to book off for that. Yeah, it's nice.
absolutely. That's right. Well, thank you so much for sharing a little bit more information about the portable ultrasound space, and in particular the Clarius portable ultrasound. Where can people find out some more information about this?
Yeah, you're very welcome. I think the best place is just visit our website at clarius.com. And under products, you'll see a link to our dedicated veterinary page. You'll find out more about what we offer. The C7 scanner specs as well as pricing are all there. We have a Facebook page and Instagram as well. And there's lots of places on the website. If you're interested in a product presentation, you can just click on book a demo and we get you in touch with one of our inside salespeople, and they can show you a little bit more about what's included and some examples of some imaging as well.
Great. Well, thank you so much, Shelley, for your time today and for sharing your knowledge with us about the Clarius ultrasound and portable ultrasound in general. It's been really, really informative. And if anyone is interested, please contact either myself or jump on the Clarius website and find out a little bit more. But thank you so much for your time.
Thank you. Absolutely my pleasure. Thanks for the opportunity, Philip.
You're most welcome. This has been another episode of Vet Synapse podcast brought to you by Vet Education. I hope you've enjoyed the chat we had today. Stay tuned and we'll be in touch shortly with the next episode. Thank you for listening to this episode of Vet Synapse. If you like this episode, please subscribe to the podcast and share it with your friends and colleagues. Make sure to visit our website at veteducation.com.au for more great content and to experience the latest online race-approved veterinary continuing education.